Welcome, my friends, to the Sage Aquay Radio Hour, your home for free and critical thinking, and I'm your host, Mike Williams. Tonight, Sofia Smallstorm returns to the show. Sofia will talk to us about a presentation she recently reviewed called Iodine. Could this be the solution to your health problems? The presentation is from the Iodine Medical Conference, which took place in 2007 in California. Presenting at the conference were Drs. Guy Abraham, David Brownstein, Bernard Eskin, Jorge Flechas and William Shevin. The conference presented the clinical findings of using iodine therapies for various persistent health issues. And quoting Dr. Brownstein, quote, "Iodine deficiency is the underlying problem responsible for the high rate of cancer, particularly breast, lung, prostate, and ovary, as well as the high rate of autoimmune disorders we are seeing in this country." The link to the iodine presentation we are discussing during this show is included in the show notes below. We also want to make sure that our listeners understand that my discussion with Sofia should not be construed as medical advice in any way. The intent of our conversation is for information and awareness purposes only. Anyone interested in understanding more about iodine should consult with a qualified healthcare professional. And with that being said, I think you're going to find the topic extremely intriguing and very interesting. And so without further ado, here's Sofia Smallstorm. All right, so Sofia, you sent me a link to an iodine presentation, and you asked me to take a look at it because there was some very eye-opening information contained in the presentation, and I did look at it. I went through all 96 slides. You were right. There's a lot of information there, and looks like iodine is something else that is very good for us, good for our immune system, but has been taken away from us. So I was wondering maybe if you want to just explain that a little bit to us.
Yeah, this particular PowerPoint was posted on the website slideshare.net/medicineandhealth14 and then /iodine. And there are some capital letters and whatnot, so I know this is going to be case sensitive, so you might as well put the link up, Mike. But it was, it's been out there for many years, and I had not heard about it, and my nutritionist friend who turned me on to iodine, she sent it to me a few months ago, and I went through the slides. I took a lot of notes, and like you, there was a lot of stuff in there that I had not known about iodine, and it's a very convincing PowerPoint collection of information in PowerPoint form. But I'd like to get this iodine information out there because it's something for people to really consider. It's a very elementary, very inexpensive way to boost your well-being. And I think one reason it's been so suppressed is because there's no money in iodine. Iodine is an element. It's a very simple single element that if you believe that we originated from the ocean, that we were aquatic at one time in some form, whatever form you choose to picture this as, then we were surrounded by iodine. There's plenty of iodine in the ocean. It's a mineral. And we then, as we left the ocean over however long a period it was, and we developed legs and we walked and we breathed the air, and we developed glands that could store iodine. And the body stores, you'll learn from this iodine presentation, 50 milligrams of iodine per day. That's like the size of the iodine tank, so to speak, which is distributed throughout the cells. And I think in one of these early slides, men will discover a great benefit from iodine supplementation because it really builds lean muscle. And I had presented a friend of mine who's a trainer. He's a master trainer at one of the gyms here. And he was in his 50s. And I gave him a little bottle of iodine to try. And he spoke to me on the phone a few days later. And he said, "Boy, I'm taking this as soon as I wake up." And he said, "I never felt so good in the parking lot driving to work." And then he told me he was putting on all this lean muscle mass. And he couldn't believe that in his 50s, because that's late in life to be, developing lean muscle at a rate that you hadn't noticed it before. So I think iodine is a very uplifting thing overall and very inexpensive. So it became more useful for big pharma to not have to compete with iodine. And I think they used iodine to address, any number of conditions in the past. Lugel's formula, which was 15% concentration, and now that has been regulated down to 2 to 5%. That's about the concentration you can buy today, and you're not going to find it in drugstores as you once used to. So Lugel's iodine is a combination of potassium and iodine. It is potassium iodide. Iodine is one of those elements that is very volatile, and it doesn't like to be by itself. So much so that iodine is a dual atom molecule, I2, like fluorine is F2. And fluorine, iodine, chlorine, bromine, and then there's another astatine that we don't know, we don't get much information about. It's not really part of biological life, I don't think, to my knowledge. But those other four, they're all kind of related. I call them cousins. And the one that's truly body-friendly is iodine, but bromine, chlorine, and fluorine are considered to be toxic. And they all like to be in dual atom form in their separate molecules. You'll never find fluorine by itself in nature. It goes and finds another element to marry with. And it's called the bully of the periodic table because it presses itself onto other molecules. So that's how we get the term fluoride. Ide just means a compound of the ione form. So you get, calcium fluoride. Little spikes of calcium fluoride form in your calcium-rich tissues when you're exposed to fluoride, when you have it in your drinking water and you're, touching and encountering a lot of substances that are made with fluorides or contain fluorides. And fluorides go and find calcium, and or fluorine goes and finds calcium. And so you get these spikes on your calcium-rich tissues, which cause a lot of pain when you try to move muscles across them. Joints have calcium in them, ligaments, tendons, bones. So these little spikes, these calcium fluoride burrs, are very painful to have to live with. And as they grow, it becomes harder and harder to move. And this is the root cause, I've understood, of arthritis.
Very interesting. Sophia, when I was reading the charts, they said that iodine levels had fallen 50% in the last 30 years.
Oh, yeah.
And they were making a correlation between, during this time, the charts said that elevations in autoimmune disorders, thyroid cancer, breast cancer, prostate cancer, and other cancers, and many other diseases, including fibromyalgia and chronic fatigue, have occurred. So I'm not sure that they actually made a direct correlation, but they're seeing as iodine has been taken away, these other types of disorders have become more prominent.
Oh, yeah. Iodine is a great regulator because it's the main component of thyroid hormone. So your thyroid is it's like the master gland in your body that regulates your glandular system pretty much. And it produces 4 hormones. That's all it does. And those hormones are abbreviated as T1, T2, T3, and T4. So those numbers, 1, 2, 3, and 4, they stand for how many atoms of iodine are in that particular hormone. So T1 has 1 atom of iodine, T2 has 2, T3, T4. They also have their chemical names. T4 is thyroxine. It's very important for brain development and brain function. And this is why a lot of people who start to supplement with iodine say that their brain fog goes away, because they're getting thyroxine. So what happens when you say iodine was taken away from us, when you have, a lot of exposure to what I call iodine's dangerous cousins, the halogens that sit with it in the same lineup of the periodic table, when you have a lot of exposure to chlorine, fluorine, bromine, which are now prevalent, you have chlorine in drinking water, you have it in household cleansers, everything is bleach and chlorine based. You've got fluorides all over the place. They're in plastics, flame retardants. They're used as pesticides, food container linings, to say nothing of drinking water or toothpaste. And then you've got bromine and bromides all over the place also. Bisphenol A and plastics, they're brominated plastics. Cash register receipts, those shiny receipts, they have bromine in the coating. So every time men handle these receipts, they end up, absorbing this feminizing material, these chemicals.
Right. That's right.
And so we end up, because now I've coined this term myself, that the body is largely biochemically blind. It is used to certain arrangements of atoms in molecular form, and it's not used to unnatural things that look like something it's used to naturally. So what I'm trying to say here is that when you have bisphenol A appearing in the body, it's shaped very much like a molecule of estrogen. So it starts taking up residence on estrogen receptors in cells, just as bromine, chlorine, and fluorine, or these fluorides, they're very much alike. Fluorides, bromides, chlorides, and then iodides, like potassium iodide. So the body doesn't really know the difference. So your iodine receptors, which are on cells and glandular systems, cells throughout your body, they start grabbing at fluorine, chlorine, and bromine molecules. And this is what sits on your iodine receptors. And so your poor old thyroid, according to Dr. Brownstein, who's, extensively mentioned in this presentation, you're making brominated thyroid hormone. Can you imagine? You're making chlorinated thyroid hormone, impairing the functionality of all the systems that depend on iodine. And so the sexual organs and all the glands in the reproductive system love iodine. It is said that enlarged prostates are much like enlarged thyroids. When your thyroid doesn't have enough iodine, it actually swells. A radiologist told me this. And it's basically saying, where is the iodine? It's getting bigger and bigger, looking for iodine. And you can look up goiter on the internet, and you will see pictures of people in landlocked areas, not close to the ocean, where there isn't a lot of iodine. And you'll see these giant, like lumps, weird-shaped lumps in their necks. And their neck has this, it almost looks like a big baseball sticking out. That's how bad goiter can get. So that was happening in the Midwest in the 1920s. They decided to, actually it was happening for a while, because those are the landlocked states. Now, there are people who would argue with this, but we had iodine at one time in soil that was rich and mineralized. And of course, it shows up in greater concentrations in mineralized soil that's near the coast, because there's iodine vapor in the air near the coast. There's the seawater has a lot of iodine in it. So there's more iodine in coastal regions than in landlocked regions. And it is said that as the glaciers came through, in the Ice Age, through those Great Lakes areas, they stripped the soil. And modern farming strips and erodes soil also with all the chemicals they dump into the soil, and then they don't give it a chance to regenerate, and they don't rotate, fields. So this has caused modern produce not to have the amount of iodine in it that produce had maybe 100 or 200 years ago. So people are not getting enough iodine from food sources any longer. And landlocked people don't have access to fish with iodine in it,
So this is interesting, Sophia. So we know that at one time iodine was used by medicine, goiter, as you had mentioned, and many other types of ailments and disorders that people were experiencing. And then, as I mentioned before, over the last few decades, it has essentially been taken out of the diets, and and many people today suffer from iodine deficiency. And in its place, based upon me reading that presentation, they introduced things like the bromine and the fluorine and chlorine. And I think what I was hearing you saying is that's because these types of things are very close in structure to the iodine. Did I hear that right?
Yes. The
Okay.
halogens are electromagnetically negative in their charge. They're very similar in their molecular configuration, in their atomic mass. So the arrangement of these molecules, the bromides, the chlorides, the fluorides, and iodides, and then, of course, in individual form, if the body ever happens to catch them in that form, bromine, chlorine, fluorine, iodine. iodine is how we should say it. They're all almost alike. And living organisms absolutely cannot distinguish between these molecules very easily at all.
Okay.
So that's what I mean when I say biochemically blind. Body is used to iodine. It sees bromine or feels bromine or senses a molecule swimming around in it that's very, very similar, and it grabs it. And so what's happening is our cell receptors in our body that want iodine, and as I mentioned, these would be the reproductive organs and systems. Then there are tissues of the red blood cells, salivary glands, tissues of the eye, the brain, intestinal cells. These are all parts of the body, systems of the body, areas of the body that need iodine. Ultimately, iodine travels to every cell and does a very nice job of whatever it does. I think it has different functions all over, but anyway, it's needed by just about by every cell in the body. This is what the doctors say. And it's especially needed in certain systems, like breasts will compete with the thyroid for iodine. And a lot of women with fibrocystic breast disease, which is painful breasts, certain times of the month, women complain of sore breasts. All this seems to go away once you start taking iodine.
Yeah.
I think that they used this iodine therapy, as they called it, pervasively since the early 1800s. They started to treat goiter with iodine, and some people call that the birth of Western medicine, which is really the idea of using a specific agent for a specific condition. So today, iodine has been totally demonized, and the question that is asked, it's implied in this PowerPoint presentation is, why did they substitute bromine, chlorine, and fluorine into our lives in place of iodine? And, the suggestion is this is stupid, this is senseless, but my feeling is there's, as I'm sure you'll agree, knowing what they know, this is the way to give us more problems that they can then attempt to fix.
I absolutely agree. They knew what the benefits were. They took it out. And then they knew that these other substances like fluoride and bromide, the body thinks that you're getting iodine.
Exactly. Now, interestingly, in 1963, Stanford University decided to put iodine in its 5 swimming pools. It's a big university with a big swim team because it's California, and big competitive swimming pools. And iodine, much like chlorine, is a disinfectant. It's an antimicrobial. So for this one short period of time, I just think it was a few weeks, they used iodine to disinfect the swimming pool water at Stanford. And the result, the reactions of students who swam in it, and then, of course, people from other areas of the country who came to compete in swim meets, everybody loved it. They all said, wow, our skin doesn't itch and our eyes don't burn and our hair isn't drying out and turning green. It's wonderful. And apparently you can get away with a lot less iodine than you would have to use chlorine in this swimming pool situation. It would end up being cheaper and much better for you, very body friendly. But of course, they reverted to convention, as everybody does now. I mean, hot tubs actually have bromine in them, and swimming pools chlorine, and it's crazy. This is what we use to disinfect, pools of water now.
It's interesting you talk about bromine, and in the presentation, it says that bromine is a toxic substance with no known value in the body.
That's right.
No known value. So I agree with what you said before, that it's all connected, that they took the iodine out and they introduced these other elements, knowing that the body would be confused. But unfortunately, these other things that are being introduced to your body, like the fluorides and the bromides, they're unhealthy for you. They will cause you illness. They will cause you to have diseases and disorders.
Well, sure. And they're stored in your body. One of the notes I took from the presentation was that Oxidized bromine is stored in fat tissue. And when you see these really gigantic people, staggering around, if you just go out into the public, you'll see them. These people are not just overweight, they're toxic. And their body has produced loads of adipose tissue. It's deposited fat around itself to bank and store toxins that the organs can't filter out. And remember, Mike, when we were younger, I think we're about the same age, how very fat people, our parents whispered behind their hands, that these people had thyroid problems.
Right.
Remember that?
Yep.
So if you were obese, you were considered to have a thyroid problem. And I never really understood what that meant, and now I'm understanding that in a whole different light. But today we have an obesity epidemic, and nobody's talking about thyroid problems. They're, faulting these people for eating too much junk food and carbohydrates. But the fact is, people have developed, there's been this escalating obesity because people are more and more toxic.
That's right. I agree, Sophia. People are walking around, their body contains an enormous amount of toxicity. I mean, they're not eating well, they're eating the wrong things, they're not getting the iodine, they're taking in the fluoride, and all these other elements that are just being introduced into the body and the mind. And they're contaminated, they're polluted, and they don't even know it.
Yeah. And they're in enormous discomfort.
Right.
Which just becomes a way of being. And what I noticed when I started to take iodine, which was about 4 years ago, was that my way of being just completely changed in about 2 weeks. And I wasn't even taking very much. Because you have to start out very slowly. It's a volatile element, iodine. So you have to start with like 1 drop, And that's the nutritionist who turned me onto it. She said, start with 1 drop on the first day, and then very slowly, like a drop a week, go up. You want to go up very, very slowly. And they talk in this PowerPoint about iodine saturation, which really surprised me because it's a lot. 50 milligrams, they say, is the saturation level. And these doctors discuss it. There are the different doctors. This presentation collects the work of 3 very famous iodine doctors, Guy Abraham, David Brownstein, and then Dr. Flechas. I can't remember his first name. But they are the iodine kings. They are the ones who have woken the world up to the benefits of iodine again, particularly Dr. Abraham. But they have their various theories, which are laid out in this presentation about iodine and iodine saturation. I did not know very much about it.
Well, I'm going to include the link, Sophia, to the presentation so people can take a look at it, maybe even as they're listening to the show. The other thing I want to also mention to everybody, just before we proceed here, is that we're not giving medical advice. Just want to make sure everybody understands that. We're just essentially going through this presentation and explaining what it is that we've uncovered by reading it. If you're deciding to go down this path or you want to take iodine, that you should make sure you see somebody who's qualified to give you the proper advice.
Right, and I think it's important for people to wake health practitioners up to the value of iodine. Like if you have someone you consult, even if they're alternative or allopathic, send them this presentation. Say, take a look at this. Because these doctors unequivocally emphasize how beneficial iodine is. They state that it's anti-cancer. Iodine promotes in cells, certain cells particularly, apoptosis. Do you know what that is, Mike?
No, I don't.
That's regulated cell division. Some people call it regulated cell death. So cancer is what they call an infinite cell line. The cancer cell is so toxic that it doesn't know when to stop reproducing. It's psycho, in a sense. It's trying to replicate as a mad effort to preserve itself, to stay alive. So a normal cell in the body or cell line, I have to understand this a little better myself. It subdivides about 70 times, 70, and then that's it. New cells will take its place. But that's called apoptosis. There's a signal given to those cells, or you could say program in those cells that say, that's it now, you have to go to bed forever. And somehow, this is what Dr. Nancy Banks taught me when I interviewed her not very recently on my own podcast, that the signaling system is getting interrupted by this enormous presence of chemicals in the body, particularly chemicals that confuse our biology to the extent that fluorine, chlorine, and bromine do. So the cells aren't getting the signal to turn off and die. And iodine, according to these doctors, promotes apoptosis in a very dramatic way. It really is a good regulator in that regard. And so simply put, it's an anti-cancer agent. And the manufacturer of nascent iodine, also known as mag-nascent iodine, by the way, I have iodine in my online store, and a very small trial size bottle, which is easy to start with because it's cheap and a quarter ounce. So the manufacturer of that iodine points out in his leaflet that accompanies the bottle that the incidence of breast cancer in the United States has soared right alongside iodine deficiency. And so have these rates of prostate cancer, and all the sex organs, the reproductive organs really, really love iodine. I have anecdotes in my own anecdote library of people who took merely 1 drop of iodine, and after many years of great discomfort, like having to get up to go to the bathroom 6 times during the night, and then 1 drop of iodine reduced the size of this man's prostate enough that he didn't have that problem anymore.
You know, it's interesting, Sophia. I went to a site called Organic Facts, and I wanted to understand a little more about the symptoms of iodine deficiency. So this website states that a deficiency of iodine can have serious effects on the body. The symptoms of iodine deficiency include frustration, depression, mental retardation, poor perception levels, goiter, abnormal weight gain, decreased fertility, coarse skin, chances of stillbirth in expectant mothers, constipation, and fatigue. So, I mean, these, I guess, are just some of the symptoms. So I just want to put that out to the audience because I want you to have some kind of reference point, a baseline. If you're suffering from some of these things and you're banging around trying to figure out how it is you can feel better, you might want to take a look at your iodine levels.
You know, one of the things we have to remember is they've changed what they call normal.
Yeah.
And the RDA for iodine is so incredibly low now.
It's very low, yeah.
So, you know, Dr. Abraham has an amazing take on that. I don't even want to say it on the air because it sounds so totally crazy, but you can apparently take a lot more iodine than the RDA and not even flinch.
Yeah, well, the audience can go to the link to look at the presentation. He has it there.
And again, I would encourage people learn about this and then start discussing it with people who are, you know, into health, and particularly healthcare practitioners, because they really know very little about iodine. It's so easy as well.
Well, it's been vilified.
Yeah. So what were some of the things I wanted to mention about iodine? And we can also discuss bromine, chlorine, fluorine. Let's talk about iodized salt. So back in the 1920s, when people in the Midwest were having these goiters, very big, enlarged thyroids, I had a goiter. Someday I will send you the picture of me. I took a passport picture. I had one taken, I think it was maybe 6 years ago. And I found it the other day, and I looked at my neck. It had this horrible, like, huge lump sticking out. And I remember then that I often had the feeling of like a golf ball in my throat. And they also say that if you have an enlarged thyroid, you'll have this like choking sensation sometimes. It's very low grade, but you feel like you're being strangulated, you know?
Mm-hmm.
And it's because your thyroid is too big. And when I saw this picture, I could not believe it compared to how my throat looks now. I always figured I had a small neck and, you know, that was my larynx or something. I don't think I even really knew it was my thyroid, but boy, it looked bad.
How long have you been taking the iodine now, Sophia?
4 years.
4 years, okay.
And within 2 weeks, I felt phenomenal. And
Wow.
as I said, I started out with really very few drops, and I couldn't believe. So let me just tell you my little story. In the summer, I go in the ocean all the time. I do these ocean swims, and I'm outside. I'm at the beach a lot because it's the summer, and I live in Southern California. And in the summer, I feel phenomenal. I'm happy. I've got loads of energy. And of course, then when the fall comes and it gets gloomier and there's less daylight and it starts to rain, and you have to go indoors. I don't swim in the ocean in the winter. The water's just too cold and too rough. So I swim in the pool. Of course, I'm getting a load of chlorine when I do that, and I end up just kind of feeling much more low energy in the winter than I am in the summer. And that was in the past. So here it is November, and my nutritionist friend that I had just met, she's turned me on to iodine. So I'm taking iodine, and within a week or two, I'm starting to feel incredible. I'm all excited. I wake up in the morning, and I can't wait to jump out of bed. I don't drag myself in the afternoon to exercise as I normally do in the winter, thinking, oh, do I have to go? Do I have to? But I'm very disciplined, so I would make myself. But no, now I have all this energy, and I realized, you know what? I feel like I feel in July and August and September. How is that possible? And as I started to read more about iodine, I realized, you know what? In the summertime, I'm absorbing all this iodine from the ocean. And now I'm taking it in drop form. So I'm actually getting iodine, which is what's making me feel so good. And then over time, you notice lots and lots of things start leveling out. Like I had a lot of stomach aches. As you age, you don't produce as many digestive enzymes, and all of that got better. Then you'll notice your skin, your hair, it all starts to brighten up,
Yeah, it's interesting, and you mentioned about the water and the water having the iodine in it, the sea, the ocean. And I was just thinking to myself, and then they put the fluoride in our water, and then we shower in it.
Of course.
You know?
It's horrifying.
Yeah. Yep.
And one of the things I wanted to mention, I should quickly finish because I've started to say this about 3 times. So in the 1920s, the U.S. government came up with iodized salt as an answer to the high incidence of goiter being found in the Midwest because it was landlocked. And they figured, salt is a staple. We'll put iodine in it. They were doing this in flour as well. And I've never quite understood why. I've heard it was a dough conditioner. They put iodine in bread dough, and that was taken out as well about 30 years ago.
Right.
And the iodine in the salt was added because salt was a staple, flour and bread staple, there you are again. So the government figured this is a way to beef up the iodine for the public, but remember that they were putting iodine, or they are putting it, in table salt, which is not a good food because it's simply sodium chloride, and it doesn't have the dozens and dozens of trace minerals that natural salt or sea salt has. So even table salt starts out as natural salt, but then it is stripped. It is bleached. They put acid treatments on it. They add flowing agents to it, because they want it nice and white. They want it to pour out of that Morton container and look all, shimmery and even. So the treatment and processing that table salt gets, anti-caking agents even, and I'm trying to see what else here. They call it, you'll laugh, removing impurities. But what are the impurities? They're up to 100 trace minerals that our body absolutely depends on for metabolic, functionality. So when you use table salt that has iodine in it, it's hardly going to do anything for you.
Now, Sophia, you mentioned that they had iodine in the bread.
Yeah.
Now, didn't they replace that with bromine?
Bromine. Crazy.
So this goes back to what we were saying earlier. It's not this. It's not just by chance that this happens. There's a concerted effort. At least this is my perspective. They take a look at. They know the benefits of iodine, and like, well, you know what? We can't have people have those benefits, so we're going to replace it with this. And what they replace it with just happens to mimic the same properties as iodine. And then the body gets faked and duped into believing that it's uptaking or taking in iodine when, in fact, it's taking in bromine.
Right. Or chlorine or fluorine.
Right.
Fluoride.
Right.
So when, apparently, as I understand it, when you have iodine coming into your body and it's iodine sitting on your cell receptors and getting used metabolically to do your biological everything, when fluorine, chlorine, and bromine start roaming around in your body, they don't have anywhere to go. So the iodine test, it's called an iodine loading test, I think. It's actually a test of how much iodine you're excreting in your urine and then how much fluorine, chlorine, and bromine is there as well. So if you're actually excreting iodine, it means you are iodine sufficient. And you can get this test done in labs, but I haven't had it done myself. I just go by the way I feel. If I'm taking iodine and I feel good, then I don't really personally want to test for how much I have, in me.
Well, also in the charts, they were saying by taking iodine that you will detoxify the bromine, the fluoride, the chlorine, mercury, aluminum.
Yeah, it's said to be a chelator. They are very big on that in this presentation. It chelates cadmium, lead, all kinds of stuff. So again, I'm not a clinician. I haven't had a practice or anything like that. I'm not a health professional. I'm just someone who's curious and reads. And fortunately, we can still try out supplementation. I think the day will come when that will be regulated much more than it is now.
Oh, absolutely. About a year ago, they were trying to push some legislation through that said that vitamin D was a drug.
Yep.
Vitamin D, folks, you get from the sun.
Huh.
And, so you're absolutely right, Sophia. As more and more people catch on, and if more and more people are becoming healthier because they're doing things differently, then they're going to look to put the boot down. There's no doubt about that.
Yeah, I think that iodine produces all kinds of, you could even call them complex health disorders when you don't have enough of it. And I think this is what gives rise to this feeling of, very low energy. And you go to your doctor and he tells you have some kind of chronic fatigue or autoimmune disorder, and nobody knows how to treat that.
Fibromyalgia is another one.
Yeah, it's called overactive nerves on television. Overactive nerves, But I think in the old days they would have, anytime you felt low, they would give you iodine. So I don't know it's staggering to me that doctors absolutely will just sweepingly say, do not take iodine. It messes up your thyroid. And I just raise my eyebrows. I am astonished when I hear people tell me that my brother-in-law is a doctor and he told me never to take iodine because it messes up the thyroid. And I say to them, but what does the thyroid do? It makes 4 hormones that require iodine. If you don't have iodine, it can't do that. How does it mess up the thyroid?
Well, I mean, look, not to knock doctors, but, and I'm sure some people are going to be screaming and yelling when I say this, but they know what it is that they've been taught.
Yeah.
Plain and simple. So unless a doctor is really focused on integrative medicine, that type of practice, then many of them, I'm not saying all of them, but many of them they go by whatever the rule book says to go by. It says this is what I'm going to say. So that's how they operate. But it's interesting, we were talking before about some of the symptoms, Sophia, and I mentioned depression or foggy mind type of thing. And then when I was going through the presentation, it said fluoride in medications, Lexapro, Paxil, Prozac. So that was like mind-boggling to me that you don't want this stuff in your body to begin with. And many of these things are contributing to the fact that you have depression or you feel fatigue or you're feeling out of sorts. And they put the fluoride in the SSRI antidepressants. Is that not unbelievable?
It is unbelievable. And I'll tell you, I actually know someone who for many years has had fibromyalgia. So some doctor put her on, I think it was Paxil or something like that, for pain management of her fibromyalgia. And she told me this, and I just said, what? I said, that's a fluoride-based drug.
Mm-hmm.
And whatever she was on, I checked it later, it was fluoride-based. And I said, that is just making your pain worse. It's making these little, and I described those calcium fluoride burrs. I said, that's why you're having to have all your joints replaced. She's had 2 hip replacements, her shoulder hurts. I mean, everything hurts. And she said, you know what? I actually went in and they did an MRI and my doctor showed me. He said, you have all these little spikes all over. They're all over your bones and joints. I don't know what they are. I said, they're probably calcium fluoride burrs. She said, well, how come he didn't know what they were? I said, because they don't know this stuff.
They don't know it. Yeah. They're not told about it, so they don't know.
Yeah. And I said, that's why everything hurts. Now, Dr. Kennedy, David Kennedy, he explains in the film, The Great Culling Our Water. That's part 1 of a 3-part series. It's excellent. I learned so much from that documentary, and it's now full-length, free on YouTube. The Great Culling Our Water. So Kennedy says in there that, I just started to get into this before, but what we have on all of our tissues is a tough coating. It's like a sheath, and it's called myelin. It looks like white saran wrap. It's very thin. It's actually very tough in itself, even though it looks fragile. But the idea is myelin serves as a mechanical lubricant. So your bones have a myelin sheath, your muscles have a myelin sheath, tendons, all that. So the idea is for same to glide across same. So this is how muscles glide across bones, because they're both covered in myelin. And that's what enables you to move around, effectively without pain. So when you have these burrs sticking out of your bones, which are calcium rich, and all your calcium rich tissues, and they're on the surfaces of your joints, that cartilaginous tissue also invites calcium fluoride burrs. What happens? The myelin gets poked and everything starts to hurt. And maybe they call this fibromyalgia. I don't know.
There's a lot of ways in which the body and the mind is being contaminated and disrupted. Fibromyalgia, as an example, that's not a diagnosis of anything. That's just a name they gave to something that they don't understand.
Right. And the drugs, by the way, I'm reading from my fluoride folder flyer. I just want to tell people that on my web store, avatarproducts.com, there is actually a tab for brochures and flyers, and I've posted 6 flyers there that you can download in PDF form. You can print them. You can do whatever you want with them, but they're all there for you to read. And so fluorides are found in Prozac, Zoloft, pharmaceutical drugs that inhibit serotonin. Blaycol was a drug. It was taken off the market due to muscle degeneration. Remember fenfluramine?
The weight loss product, right?
Yeah, it was banned for creating heart valve damage. Sarin nerve gas is fluoride-based. The date rape drug, Rohypnol, I don't know how you say it. Then there are a lot of others. And a lot of the anesthesia drugs are fluorine-based. Some have bromine and chlorine as well. So, they say anesthesia takes you very, very close to death. And the longer you are under general anesthesia, the harder it is to recover. And I was always told, it's because you were so close to death for 4 hours that for each week that you're under general anesthesia, for each hour, you need a week to recover. Now I'm wondering, maybe it's because you were fluoridated and brominated and chlorinated so heavily,
Well, also in the deck, they mentioned that Cipro, which is a very, very popular antibiotic, has fluoride in it.
Yeah. The antibiotics that they administer now for infection, they used to just treat infections with iodine, infectious disease.
Yeah.
There is a very widely used form of iodine. Its brand name is betadine. It's used in hospitals as a scrub, a body scrub before they operate on you. And you'll see patients lying on the operating table and their bodies are stained brown because they've been, wiped all over with iodine. And that is sold in drugstores as povidone iodine. But people ask me all the time maybe I'll take some povidone iodine. That has a lot of chemical agents added to it, at least 9 other chemicals. One is a spermicide even, is in povidone iodine. So that you're not supposed to take that orally at all.
I was just looking at the one chart that talked about the symptoms of hypothyroidism, and boy, you know, Sophia, I look at this list. Anybody looking at this, or they go to the presentation, I'm sure a lot of these symptoms would resonate. Brittle nails, carpal tunnel syndrome, depression, dry skin, eyelid swelling, fatigue, hair loss, headaches. You had mentioned before about difficulty swallowing.
Mm-hmm.
Yep. Infertility, muscle cramps, muscle weakness, muscle and joint pain, poor memory, throat pain, weight gain, and so on and so on. These are all symptoms of hypothyroidism.
And hypo means low. And then there's hyperthyroidism as
Right.
well, you know, and there are certain autoimmune diseases like Hashimoto's and Graves' disease that have to do with the body attacking itself around thyroid functionality. I'm not sure. These are very difficult diseases to understand. I think even a lot of doctors don't know how they work and what they are and how they happen. But these doctors, Dr. Brownstein, David Brownstein, he's in the Midwest. His schedule is full, so you cannot even get in to see him now. Because a friend of mine tried. But anyway, maybe it isn't anymore. But he's very, very much in demand. He definitely holds in his book, Iodine, Why You Need It, Why You Can't Live Without It. That's Dr. Brownstein's book. He definitely holds that the autoimmune diseases also have to do with iodine insufficiency. And there are other doctors you can find who have been doing this, but not as, publicly as Brownstein. I mean, I have to give that guy credit. Between Brownstein and Abraham, they have really brought us this amazing information.
Yeah, and like I said, I mean, the link is going to be down below, folks, so you can take a look at the charts. They are 96 slides, but they're not 96 eye charts. The font is big and it has a nice flow to it, so you'll be able to go through it in about 30 minutes or so, and then you can pull from it whatever it is that resonates with you.
Yeah, I think also that chart is something, or that PowerPoint is something that you can look at a number of times and refresh yourself on it, because the more you learn and notice about any of these things, even if you, like, say, start taking iodine, and then you review this presentation, you'll go, oh, that is happening to me. I mean, there's, Mike, has this ever occurred to you? We have so much information out there that we need to know and we feel we need to know, but we can only take in some of it.
Right.
Do you remember the movie What the Bleep?
I do.
Yeah, well, when I saw that movie for the first time, it just blew right by me. I left the theater and I thought, my mind was a whirl, and I thought, what did I just see? I was very impressed, but the only thing I could remember out of that whole film was the thank you experiment on the water crystals. Dr. Emoto, Masaru
Yes.
Emoto, or Emoto Masaru as the Japanese call him. I could not remember another thing, period. So I ended up going to that movie 7 times.
Wow.
And
7 times?
I took notes. Yeah. I know a lot about that movie. It was screened experimentally in Arizona. I think it was Tucson, in Portland, Oregon, and in San Diego, Encinitas. And the guy who ran the theater here, the La Paloma, he actually bumped all of his big movies that summer. He just ran What the Bleep month after month after month. The lines were forming around the block every single night. He bumped his big surf movies of the summer and just showed What the Bleep. And people came from LA 2 hours away to watch this thing. And they came multiple times. They came with tape recorders to record stuff, although I think it was forbidden. They took notes. I took copious notes. I sent my notes. I typed them all up. I sent them to friends all over the country. My What the Bleep notes, they became famous in my little circle because nobody could remember anything from the film. It was so new. It was so different. And what I'm trying to get at is all this information that we're now being exposed to about real health, about how the body really works, what the body really wants. It's tremendous. And there's a barrage of it. And where do you start? And what are you going to remember? And you have to just slowly start integrating different things into your own regimen and seeing whether they resonate, how they work. But there's so much to learn.
There is a lot to learn. And what I'm noticing, Sofia, in my practice is we're having a very organic awakening throughout the populace where people are now opening up more and more to alternative types of treatments and medicine.
Yeah, to treatments that are much more natural in their origins than man-made. Because, as I said before about the body being biochemically blind, it just doesn't expect certain kinds of molecular compounds or configurations, and it doesn't know what to do with them. And ultimately, if they're not suited to biology or nature, they will be regarded as toxins, and the body will try to get rid of them. And when it has too many, it can't get rid of all of those toxins.
Well, what happens is the body exerts a tremendous amount of energy to figure out what to do with those toxins. It gets introduced into the body, and then the body says, okay, what is this? What do I do with it? I'm
reaching for my notes from Nancy Banks' book, AIDS, Opium, Diamonds, and Empire. And her book really gives you a biochemistry lesson on what's called oxidative stress. Oxidation is loss of energy on the cellular level. So as cells work too hard, as they overwork, they become energy deficient. And an energy deficient cell starts to perish. And when you have systems of cells perishing, your body starts to decline in serious ways, you know?
Yep.
So this loss of cellular energy, it's called the redox balance. The ratio between uptake, which is called reduction, strangely enough. This is part of the reduction of ATP into its precursors. ATP is the fuel molecule of the cell, adenosine triphosphate, and it is a nano machine, effectively. It's in each of your cells you have perhaps millions of ATP molecules, and they are so small that they are nano-sized. And so all day long the cells take electrons out of ATP, and then the mitochondria have to find more electrons to repack or recycle or reconstitute ATP. And ATP becomes reduced into its precursors, adenosine diphosphate and monophosphate and certain other compounds. But this ATP cycle, the replenishing of cellular fuel and then the loss of cellular energy and the inability of the body to build up that fuel battery again, that's where people start to lose ground. And in contemplating, as you put it, what to do with these new compounds, for instance, sucrose is one glucose and one fructose molecule, but very difficult to break apart for the body. It takes a lot of energy to undo the bonds in sucrose. And so sucrose, I heard Dr. Sinatra say, really amps up your AMP. It reduces your ATP. It's too much work. And that fructose, your body sends that into the fat bank, you know.
Yep. So
anyway, there's so much to understand here. And for the doctors, it's tough.
Well, it's tough for the doctors because, the doctors, Sofia, they know what they know based upon what they learned in school. And unfortunately, unless they are practicing integrative medicine or holistic medicine, they're kind of contained within a box. And it's not that they're bad people. It's just that's their environment in which they operate in, and they don't go outside that box. So unfortunately, what happens is the tools that they have available to them are limited. I mean, they don't go outside and seek and search for new remedies or new approaches because they just don't know about them.
Yeah, and the newness for them is pharma reps coming and sitting down in front of them and offering them perks and trips and free samples, and that stuff is more oxidative material for the body.
Right.
It just tires the cells out, and it masks symptoms, and it's very cleverly designed, but over the long haul doesn't seem to work for many people, and this is why they're finally waking up and complaining about this stuff. I know so many old people who don't even want to take medications anymore because on some level they know that it's confusing their body. 20 medications?
Right. Right. All those medications and just along that line. I mean, recently there was an article I had posted on the blog about McDonald's losing so much money now because people are waking up to the fact that the ingredients and the chemicals that are in those fast foods are not healthy and they're not good for you, and people are abandoning it now. And what we're seeing is a tremendous growth, exponential growth in organic foods and more supermarkets. I don't know, where you are in California, but here in North Carolina, more and more of the supermarkets here are really building much larger organic food sections, and that's because people are going there.
Right. People want to be proud to say they're buying and eating organic. But I'll tell you something. I learned some surprising things, Mike. I learned from a biochemist that using 1 ounce of commercial sunscreen, 1 ounce, which is what the dermatologists tell you to put on every time you go outside, use 1 ounce at least. 1 ounce of commercial sunscreen will undo a year of organic eating.
Is that right?
That is right, according to Eric Kreider of Cabana Skincare, biochemist, Stanford trained.
Holy smokes.
Yeah. So it's for this reason that I've put on my website, which is avatarproducts.com, his sunscreen line and his magnesium cream, because his sunscreen is pretty much food grade. It has a few ingredients, that's it. It doesn't have this long laundry list of all unpronounceable stuff that even good sunscreens, so-called good sunscreens, if you look at the ingredient list, very, very complex. Also based on petrochemicals, a lot of nanoparticles are putting into sunscreens, nano zinc, nano titanium, and just bad, toxic. Remember that your skin is your biggest mouth, and what you wouldn't put in your mouth, you shouldn't put on your skin either.
That's very disconcerting.
Yeah, isn't it? It's a mind blower.
That is very worrisome. So you sell this organic sunscreen product?
Yeah, it's called Green Screen, but it's on my Sun and Skin page on avatarproducts.com. The thing I really, really want to talk about, 2 things I just discovered. Well, I discovered Eric's magnesium cream right after his sunscreen, and I just ordered a few tubes of it, and I sold out immediately. And it is so good. You asked me a little bit about magnesium, but second to iodine, we're deficient in magnesium. It is the dominant intracellular ion. So in the cell, we've got to have magnesium. It's very important for biochemical exchanges on the cellular level. I've heard it participates in up to 700 of these biochemical transactions in the body. I've heard 300 and I've heard 700, so maybe it's in between. But it also deacidifies the blood, and as you may know, that the more acidic your system is, the more disease prone it is.
Yes.
So what happens is the cells themselves, which like to keep magnesium in that intracellular mix, they yield their magnesium to the bloodstream to keep the major organs running. Because your body wants you to walk and breathe and talk. And many people are quite dehydrated and exhausted on the cellular level, even though they're walking around. So when your magnesium is yielded from inside the cell to outside the cell, to the extracellular matrix, the bloodstream, that magnesium is regulating the pH of the blood so the vital organs can function properly, but the acidosis is now happening inside the cells. And that leads to premature cell death, and then maybe, even a system starting to fail. Individual organs or systems failing in your body because they are compromised by too many of these dying cells. So one thing people do is they go get a blood test and they get their magnesium measured. But guess what? That's measuring the magnesium in the blood. It's not able to tell you what's in the cell. So you could still have magnesium deficiency on the cellular level, but it reads all right in your blood.
Is there another test, Sophia, to measure it at the cellular level?
I don't know, honestly.
Yeah.
I mean, imagine that would be expensive. That's not a normal kind of thing to do. But strangely, optimal magnesium supplementation is not through your mouth, through tablets and these powders. There's a product called Calm that is very popular, and people take it. I can't take it because it moves smooth muscle. So anything you take into your gut, your intestinal tract is smooth muscle. And if you have hypermotility in your intestines, you'll just dump whatever you've taken in. So you'll dump all that magnesium, and you'll dump other kinds of ions and water. And so taking magnesium through the skin means several things. You can actually get more of it into your body, and you can deliver it exactly to sore spots, because magnesium, since it relaxes muscle tissue, it works kind of in opposition to calcium. Calcium rigidifies, it tightens, it makes everything hurt, it makes everything hard. And we really have too much calcium compared to magnesium. The body wants an even ratio, an equivalence of calcium to magnesium, and it's tilted where we've got too much calcium, too little magnesium. So if you put magnesium in spray form, magnesium chloride spray, onto your stiff neck or your sore knee or whatever, it relaxes those tissues. It's very effective. I mean, it works in a couple of minutes. And that's a very cheap, easy way to take magnesium and then also to keep replenishing magnesium in your body, to keep a steady amount of it going.
Is this something you sell also on your site?
The magnesium cream I do because it's so unusual and it's so popular. And you can buy magnesium spray. It's often called magnesium oil, but it's not oil. It just goes on a little slippery and then it dries. It's tacky. So if people want to know the difference, the oil is 32% concentration. It's a brine, so it's a saturated magnesium chloride solution. And it's very easy to use. You can also pour it into the bathtub and soak in it the way you would Epsom salts. But it seems to itch and tingle women. This is what I have discovered. Women complain about magnesium oil or magnesium spray because it's itchy. And I know this, if something itches, people are not going to use it. And they say that if you get sufficient in magnesium, you won't experience that itching. I don't find men to complain about itching at all. Maybe they're hairier, maybe, I don't know, they're less sensitive, but men really like the spray, which I don't sell, but you can find it anywhere. Magnesium oil, magnesium spray. And I'll tell you one thing, it is the best deodorant. It's an antimicrobial, so if you can get used to it and you can put it in your armpits every morning, you will never use another deodorant. It's fantastic and cheap and good for you because you're putting it right into your armpits. It's going right into the lymph. And
this is very interesting.
Yeah. So what I have is the magnesium cream made by this biochemist, Eric Kreider, and it is very, very nice for women. It's very nourishing and very, it's a 14% concentration, but because it has such good emollients, it seems to travel just as quickly and just as effectively into the tissues. So if you have a stiff neck and you put the magnesium cream on, within a couple of minutes, most people report that relaxation is already happening. You know, muscles are not tight. And it's an easy thing to carry around. So that's actually, I would say, my bestseller, magnesium cream.
Well, I'm going to have to take a look at it myself.
Yeah.
That and the sunscreen. I'm very interested.
The sunscreen is a great product. It's a tinted, matte, zinc-based product. So you can buy it in different colors to go with your skin tone. It blends in pretty well, but you've got to blend it in thoroughly. And there's also a white version that, like the lifeguards use, zinc oxide. And you're not going to end up looking pasty white if you just blend it a little bit into your skin. But it's a good sunscreen. It's not as convenient as the store sunscreens because they are really see-through and you don't have this blending issue. But honestly, that stuff, what I learned from Eric, it's got terrible, terrible contents, and you don't want to use that on your skin. And you certainly don't want to use the spray sunscreen. You see these mothers, and they just stand their children up, and they spray them with this horrible smelling stuff that floats your way. That stuff is flammable, Mike. There have been reports of men who have sprayed that on their arms, and then they go and they grill, and their entire arm catches fire.
A little extra for the barbecue.
It's horrible. Imagine seeing that, So that's the spray sunscreen. It's very easy to use. Again, the convenience. Every time there's this convenience factor, there seems to be an associated, like price you have to pay.
Yeah.
So I learned about this magnesium, and I was happy to bring it to other people through my website and some of these shows.
This is excellent, Sophia. I mean, are there other products that you have? Because my interest is very piqued that we should let the audience know about. I mean, not to promote the selling of the stuff, but to promote what these products do from a health perspective.
Well, I have the iodine, the magnesium, the sunscreen. Oh, I forgot. Himalayan soap berries. These things are a trip. They grow wild in the foothills of the Himalayas. They actually come from a tree called Sapindus mucorosi. And Sapindus mucorosi has the highest surfactant content of pretty much anything on the planet. So surfactant is this slippery material that acts as a natural soap. And you can literally take 6 of these little brown berries. They're dried. And when you buy them, they come that way. They come dried. You put them in a little mesh bag or muslin bag. That arrives in the package as well. And you throw them in your washing machine with your clothes. And that's it. They'll do your clothes. They'll get them so clean. They'll smell like they dried in the sun and wind. There's nothing in this except natural surfactant. And they clean your clothes better than anything that I've ever used in the form of detergent. And it's so cheap. So these little berries, one collection or little bag of 6, will wash 8 to 10 loads of clothes. And then you just put 6 more berries in the bag and do more laundry. They have an extract that you can buy. I now sell that. It's called 18X. And that is the concentrated surfactant from the soap berries themselves. You can boil the berries on your stove and reduce, and you'll get the same stuff. But you can also buy it bottled, and you use half a teaspoon to a teaspoon for your laundry. You can dilute it and do your counters and cupboards and floors and wash your car, carpets, anything. But I would say start with the soap nuts. Sometimes they're called soap nuts because they release this completely natural material that takes out soil, odors, and also it's a fabric softener. You will not believe how soft your clothes come out. So this is the detergent replacement in the universe, as far as I think. And people who have allergies or sensitivities to the stuff in commercial detergent, it has a horrible smell. This is all eco-friendly. It's got no fillers, no dyes, no perfumes.
Okay, well, I'm going to be visiting your website right after we get done here because I'm writing all this stuff down, and I'm very, very interested.
Yeah, it's another thing to do that makes you happy that, there's no packaging basically to this. You don't have a big old plastic laundry detergent container. And when these things are used up after you've done 8, 9 loads of wash, you can throw them out the window. They will biodegrade. They're like acorns, you know, or you can compost them. But I just think it's a very unusual, it just gave me tremendous relief that we had this, in the world. And how did I never hear about it? But I never did. And when I finally woke up, I started ordering it. And you can get a little sample for $3 on the website. So, that's one way to introduce yourself.
Okay, I'm definitely going to introduce myself to it. I am. I mean, this is, and you said, well, you're surprised you didn't know about it. But, there's a lot of stuff we don't know about, Sophia, because a lot of the stuff is just, it's suppressed. If you do the research and, you pursue it, yes, you will come across these things. You'll stumble across it. Like right now, I didn't know anything about this until I was having this conversation with you. Now I know, but that's part of the problem. None of this stuff is talked about. It's not put out there for people to take advantage of.
Well, we also believe that formulated products reflect and stand for progress. Now, my friend was telling me when I discovered the soap nuts that she was out hiking. This was many years ago. And she and a friend were out there in the wild, and they had really dirty clothes. I mean, they had clay and mud and just sweat and everything in their clothes. And they came by a stream, and they were sitting dangling their feet, taking a rest. And the friend said, there's yucca in this stream. And he said, that means this stream will wash our clothes. I did not know that the yucca plant contains surfactant, but apparently it does. So they took their clothes off, and they tied all their clothes together to make like a big rope. They got in the stream, and they started swishing the rope around. And she told me, my friend, within 5 minutes, their clothes were spotless. And the thing about surfactant is it doesn't leave residue. The whole reason you have a rinse cycle in your washing machine is to rinse out the detergent. And quite honestly, Mike, if you do your next load of wash and you don't even put detergent in, there's enough detergent in your clothes that they'll wash themselves. Surfactant doesn't leave residue, so it doesn't need a rinse cycle, which means that rinse cycle is like a second wash. So if you want to be really cheap, as some people have asked me, you can stop your machine and you can fish around for the little bag of soap berries and take it out, because you'll double its life,
Yeah.
But there's no point. I mean, you might as well have doubly clean clothes and extra soft and cheaper than detergent anyway.
Very interesting, Sophia. Very, very interesting. I'm really glad that we did this alternative healing and cleaning show.
That's right. Alternative healing and cleaning. Yeah. All right. Well, thank you for allowing me the opportunity. And, I'm not an expert, but these are just things that I've discovered that have made my life better and simpler and made me happier.
Yeah, it's always a pleasure speaking with you. To the audience, Sophia and I spoke offline, and this is just really good stuff to get into. And, I tip my hat to you, because you do get into this stuff and you research it and you learn so much about it. And then you take it and you communicate it out so that others can be aware and that they can take advantage of these products and these approaches. It's great.
Yeah, thank you so much. I really feel that there are other people informing others as well, and at great personal expense. I mean, I know married couples in the alternative movement who are so busy that they barely have any time for themselves. And I remember one wife telling me that, yes, it was hard not to have her husband around because he's doing so much very important activism, but she said, it's important that we let others know. And she just said it with this wisdom, this kind of acceptance that this was part of their role in this life.
Yeah.
It was admirable. I'm not trying to pat myself on the back, because honestly, I'm by myself, and I just do what I do. But when you're in a family and you're giving so much, that's amazing.
And by the way, there's no payoff with all this. There's no real money involved in this. Some folks, I guess, can write a book, whatever it may be, but generally speaking, many of the people who are trying to get the truth out there and trying to do the awakening, it's not a prosperous endeavor.
You can have moments when you get a little windfall,
Yeah.
But overall, it's a long slog, and it makes you highly unpopular with the average Joes out there.
Yeah, I know. I've had my share of those interactions. People think you're a good guy until you say something that, defies their conditioning, and all of a sudden everything goes south.
Yeah, but we have each other. I mean, we all have our little network, even though it's over Skype and it's on the phone and it's through email, but we're not alone. We just need to fill in our ranks. We need to get those roads so that if you traveled the country, you could stop at this person's house and this person's house and this person's house, all the way from the east to the west. And they would all be of like mind. That would be a great thing.
It would be a great thing. And I will say that sometimes some people want to disavow the technology because it's being used for evil purposes. But you know what? The technology is also being used for very good purposes. As an example, you were saying, we can all connect. Like-minded people can get together. They can talk about this stuff. They can communicate. They can collaborate. So without this technology, we wouldn't be able to do that.
No, we'd be very alone and
right.
Maybe a lot more discouraged.
Exactly.
But we might have ESP, we might dream about each other. So we could connect that way, I suppose.
Yeah, that's the next phase.
That's the next phase, I know. I know, it would be great. It would be really great if we could accomplish something through our dreams. And isn't that what it's all about? To dream big.
Yep, exactly.
We're going to do it in a different way. All right, well, thanks again for the opportunity. And I will have those soap nuts available imminently, once again, in large supply.
And the sunscreen and the magnesium cream.
Yeah, that I have anyway.
All right.
I sold out of soap nuts, and the boat is coming. It's not my boat. The boat is docking in LA very soon from India. And my supplier told me, she was a bit bummed. I called her a week ago. I said, I'm running really low on soap nuts. She said, well, the boat just left, but it goes only 20 miles an hour, and it's just now in Malaysia.
Well, talk about a slow boat.
I know, 20 miles an hour.
What are they, paddling it? What are they doing?
It's just a very slow boat. This is called freight, It takes months.
Wow. Okay. Well, look, you know this already. It's always a pleasure talking to you.
Thank you. And you. I really love doing these shows with people like you, Mike.
Yeah, it's just relax and just say what you want to say and get the word out. It's a good thing.
All right. Well, until next time. Thank you.
All right, Sophia. Talk to you soon.
Bye.
Bye-bye now. And that concludes my interview with Sofia Smallstorm, and I hope you enjoyed the discussion as much as I did. Sophia has two websites. There's www.aboutthesky.com, where you can listen to her very popular podcast and read some of her newsletters. And Sophia is also the proprietor of avatarproducts.com. Both links will be in the show notes below. And as always, I'd like to thank everyone for listening and visiting the blog. You can get to the blog by typing in sageofquayradio.blogspot.com or simply head over to our hub website at sageofquay.com. Also, if you get a moment, please visit laboroflovemusic.com to listen to my album, Leaving Dystopia. And remember, live in truth and always serve creation. It's really that simple. See everyone next week. Be safe, enjoy, and God bless.
Telling me it's time to breathe. You're